Hello, everyone. I'm Becca, dietitian by trade, mom 24/7, wife from the start, and when there's a few extra hours in the day, you might find me hitting the trails or on horseback.
And I'm Kara, a therapist to women, a mom to a boy, an entrepreneur, mountain junkie, and a postpartum runner.
And this is Fit for a Queen, a podcast that's devoted to the female athlete wanting to balance the teeter-totter of all the things we desire out of life as women. Performance, health, intellect, and taking time for self, even if we only get 1 minute out of the day.
We're so excited to be bringing you the queens in the athletic world who have done just that. Okay, ladies, take a seat at your thrones, grab your crowns, and welcome to Fit for a Queen.
All right, queens, we are so excited. We have live and in-person Nathan Carlson. Nathan received his Doctor of Physical Therapy from Rockhurst University and focuses on the management of runners and triathletes. He is a USA track and field coach and combines his extensive experience working with endurance athletes to provide the most comprehensive care in the Midwest. His specific clinical interests include the management of bone stress injuries and tendon-related disorders. Aside from patient care, Nathan manages multiple local runners and triathletes' strength training programming. Nathan has one simple goal: provide the high-quality injury management and training experience for endurance athletes of all levels. Lastly, Nathan helps manage Chris Johnson's mentorship group, the Runner Zone, which helps coaches, clinicians, and dedicated endurance athletes refine their abilities at injury management, coaching, and strength training. Nathan is the owner of Running Mate PT and Performance. He also is the physical therapist for UMKC Cross Country and Track, so that's how I get to know him. Host of the Runner Zone podcast and manages the Runner Zone mentorship group, which we'll be sure to include in our show notes, along with Chris Johnson and Joel Setgast. Okay. Nathan also enjoys running, cycling, drinking coffee, and spending time with his wife and 2 little ornery boys. Welcome, Nathan.
Thank you for having me.
You are in the world of running.
I am.
Love it.
Yeah.
I don't know if that's on the questions, but I'm going to go ahead and ask you, how did you get so involved in the sport?
Yeah, that's a great question because I didn't run growing up.
You didn't?
Which is interesting.
Uh-huh.
So I started playing sports when I was a little kid, and like everybody does, I think, and played basketball through high school. And then when I went to college, basketball was done for me, so I needed to do something. And I'm someone who likes to be active, so I just started running.
Yeah.
And I went to school up in Iowa where there's not much to do besides just
From Iowa.
Fantastic.
Yeah, I know all about nothing to do up in Iowa.
So I just started running, and I ran a little bit more each day. And I found out that I really liked that when it wasn't someone telling me to go run, which is largely my experience before. And I really, really liked it, and made the classic mistakes that everybody makes. So I just started running all the time, and I didn't pay attention to how many miles I ran or how fast I ran. I think generally I tried to run each day faster than the last one and farther than the last one, and that led to aches and pains in college and not knowing what I should be doing and shouldn't be doing, and all this kind of stuff. And that led me towards becoming more interested in these topics. And I had a professor that was pretty deep into training, research, and things like that. And so it just sparked an interest in me. And I went to PT school knowing that I wanted to have a niche for working with specifically runners at the time, and specifically with gait analysis. And over the years, that's just morphed into coaching and strength training and mentorship for other clinicians and working with teams and individuals and, kind of all this stuff. And that's largely just happened because I've found an interest in it and been able to read research. And PT school gave me an interesting take on all this because of, what we learned there. But that's kind of where I am today, where if you would have said I do some of the stuff I do now, if you would have told me that a few years ago, I would have been like, no, that doesn't sound like anything I would want to do.
Yeah.
Now we geek out over hamster wheel and mice studies.
Yeah, exactly.
You too. Kindred spirits.
Yeah.
You're in there too.
Yeah, I do
absolutely.
like my studies.
So on that note, bridging the physical therapy and running, there just seems to be this epidemic of chronic injuries, acute injuries with runners, what are you seeing specifically?
Yeah, probably just like anybody else that is a runner, knows a runner, or is a clinician or whatever role you might take. I see a lot of people with aches and pains, and some of that is it just comes with being active. So if we look at any sport, baseball, triathlon, running, tennis, when we're challenging our body, we're putting it under a little bit of risk of something happening. The nice thing about running is there's a lot of good things that happen along with running. But there also are certainly injuries that happen along the way. And for me, that tends to be stuff in the knees, the hips, the foot, the ankle. Pretty much I spend my day focusing on stuff from the hips down. And that's because those are the areas that are working the most when we run. And so that has been an evolving thing as well, where the way that I go about managing those injuries has certainly changed over the years. And we were talking before we came on the show about this, where a lot of runners get hurt, and a lot of times the focus is I ran too much, I did too much, my running form is wrong, I'm tight here, I'm weak there, and all those things can be a factor when we look at injuries. But when we look at an individual when they're coming to see us with an injury or looking at injuries in general, there are so many things that we want to look at to make sure we're putting them in the best position to get better, and looking at, again, training habits and eating habits, and what are the things they like to do, and what their stress levels are like, and how's their relationship with their spouse. Like, there's a million things to go into, and that's been something that has evolved for me, again, as I treat people, as I read more research, and I just continue to learn that I don't know as much as I would like to think that I do.
Mm-hmm. You only learn when you have that kind of perspective, right?
Sounds like a PT and a therapist.
Yeah. Yeah.
The whole body approach. I like it.
What do you feel has kind of led to this? I mean, it's great to see such interest in running, but it also seems like it's gone the other spectrum too, where that is like almost the drug of choice for disordered exercise.
Mm-hmm. Yeah. I think there's two things. I think that running is easily accessible to most people. I mean, if you look at a sport like golf, I wouldn't just show up to a golf course and start playing. I would probably need to take, and I'm a terrible golfer, I would need to take lessons. I would need to buy a bag and figure out where I'm going to go. There's a lot of other factors. With running, I mean, most people probably have a pair of athletic shoes. You can just start.
Yeah.
So the barrier to entry to running specifically is very low. So I think that we see a large participation in people that are active, because most people have ran at some point in their life, even if they're just a kid running around, or you're playing a sport or something else. It's very easy to do, and most people are semi-familiar with it. And so that leads to a lot of people partaking in the sport. And then on the other end of things, which is where I tend to see some of my clients and patients and things like that, is social media has certainly changed everything in every walk of life. And it has provided a lot of good in the endurance world, and it's provided also a lot of not so good things, I think, where it's, I've got to run more, I've got to run faster, this person's doing this person takes this supplement, this person does these exercises, all these different things, where we end up maybe focusing a little bit too much on things that either don't matter or aren't appropriate for us at a certain time.
Sure.
And I think that's what a lot of people run into. And then the last thing, I think that consistency is key with injuries. We like to look at specific things. It would be very easy if I have a problem to buy a new shoe and that solved that problem. But a lot of times it comes with consistent training and being mindful about what you're doing and how you're progressing and those things. That's generally the biggest thing people can do to stay healthy, and the biggest thing that I see happen when injuries pop up, whether that's, again, running too much, or they're really stressed at work, or they've had a death in their family and they're still trying to PR at a certain race. When things aren't right, that's when injuries tend to happen.
Mm-hmm. And we continue to push that.
Mindful?
Yeah.
That was beautiful.
Yeah, I like that. That's such a good point of I hear so much of like I've been sick or something's happened, but I still have to do
I
Hospital
grit
Hill or
through
something.
my-
Like you don't have to do Hospital Hill.
Right.
It'll be here next year. That
Yeah.
pushing against like that wall and kind of life is telling us not to.
Yeah, there's
Mm-hmm.
there's never one workout, whether it's someone that's lifting with me or they're being coached by someone. There's never one workout that is the workout. But 6 weeks of consistent workouts might be the set of workouts that lead you to a good race or performance or staying healthy or whatever that might be. But yeah, we tend to, if something's on paper, I got to hit this pace or
Yeah.
I got to do this.
Right now,
It can be hard for runners to adjust. And so, some will just push through and other ones will just pull the plug on everything. And then again, that's when you end up just spinning your wheels. And I think a lot of injuries happen.
be a little rigid.
How can the runner sort out between just kind of normal aches and stiffness and when maybe an injury's brewing?
Sure.
Because we hear that all, like, oh man, I cringe when I hear some of the runners like that you and I cross paths with that talk about just run through the pop. I'm like,
Oh gosh,
Yeah.
that's not good.
no.
So I'll mention Chris now because I'm sure I'll mention him at some point. So Chris Johnson is someone that I work with. He's a PT and a coach based out of Seattle. He and I have worked together for a few years now, and we wrote a book together. We do a podcast together. We have a bunch of different things, and he's been a huge mentor to me. He's a very, very, very good therapist, a very good coach, and a very good triathlete too. But he was the first one that kind of proposed this framework when we're looking at, is this an injury or is this something we don't really need to worry about? And so, things that I'm looking for if someone says something hurts is what happens after 24 hours? Does it go away? If it goes away, probably not a big deal. If someone is having to change the way they're running because of something, whether their foot hurts or their knee hurts or whatever, that's generally a sign that this is something we should be paying attention to. Maybe we're not running right now, those type of things. And certainly if we go and run and then things that are normally not painful are now consistently painful. So if I go out for a run and my knee starts hurting, I go home and, later that night it's hard for me to walk up and down steps. I would say that's probably on the injury side of things. And there's obviously some gray area between that, but those are the things that I tend to start with if we're trying to figure out, is this an issue or is this just you're sore? Because again, for anybody that, if you've taken off time from running or you run a new route or, this winter in Kansas City, there's been a lot of miles on the treadmill that people are not used to. And so I have a lot of people that have sore feet and sore Achilles and things like that. And it's because it takes our body time to adapt. And if we just throw a different stimulus into it, we're probably going to get some soreness. And so I again, there's always a lot of things that we want to consider, but the idea that runners should expect 0 out of 10 pain at all times when training for something is absolutely unrealistic because then you just won't run.
Right.
I've been avoiding the potholes in Kansas City.
Oh my lands. In my car too.
Yeah.
You don't want flat tires.
Yeah.
I like that though, that assessment of like if you're probably okay, or let's watch this, or probably an injury.
Yeah.
Time to go see Nathan.
Are there certain like injuries or kind of issues that you're seeing more in, let's say, like female runners that not gender specific, but I'm just kind of wondering if there's stuff that you've been seeing more with female
Sure.
runners that you're issues?
I would say stress fractures or bone stress injuries is the kind of broad term that we have for them. The literature would support that as well, that females tend to get those at a higher rate than males. Guys certainly tend to get them too. But that's something that I see a lot of, either as a patient that's coming in with a specific stress fracture, or someone that, we're going through the assessment process and they're either a patient or a client and they say, I had a tibial stress fracture in high school, I had a metatarsal stress fracture in college, I had a femoral neck stress fracture, whatever that might be.
Yeah.
And so I see that a lot. And there are lots of studies, there's a ton of literature into bone health and stress injuries. And looking at things like menstrual function and changes that happen with that and how those can be a huge indicator of some type of a bone stress injury. And so I would say, if anything, that's the thing that I see the most in females more than males. But certainly see the gamut from, again, tendinopathy and bone stress injuries are the two main things that I see.
The
That
little
makes
IT
sense.
band.
Oh man, yeah. You feel strongly that runners should be lifting. Why is that? Tell us a little bit more.
Yeah, there's two reasons. So going back to where I got into running, it was with the idea that I'm going to be able to watch you run, and I'm going to be able to figure out how you can have the best running form possible. We're going to put you on a treadmill and put markers on you, and we're going to get all this information, and that's going to tell us exactly what we can do so you stay healthy. And that, again, as I've learned more, as I've made mistakes, as I've talked to more people, there's so many different ways that people like to move that finding an ideal pattern for running is impossible. And so as that kind of went away from me, the idea that strength training can be such a huge helpful stimulus for runners to stay healthy kind of took that void. And is largely, I spend at least 50% of my week doing that now, is programming strength training for runners and triathletes, with what I believe is programming that's specific to the endurance athlete, because the endurance athlete is different than a baseball player or a soccer player or someone else. There are lots of studies that have looked at running economy, which is this huge thing from a performance standpoint that we want to improve as we're training, and how even going through strength training, that if I look at it and I would say it's not the best, runners get more economical when they do that on a consistent basis. If we look in the literature into heavy lifting and what it does for tendons and bones, it makes tendons thicker. It makes bones more dense. It makes them stronger. It makes their architecture better. And so those are two things that I feel can be a huge component of a lot of injuries, in that we can physically make the tissues better able to deal with the stresses of running. And running doesn't do that as well. So running by itself doesn't necessarily get us those positive changes that we get from lifting, and especially getting runners into heavy lifting. So I think it can be a huge helpful thing for a lot of people. Whether you're an older runner, whether you're a younger runner, whether you're someone that's had a lot of injuries, or you're just looking to get a performance boost, I think that adding in a lot of simple things can be very helpful. And I think that runners have a hard time trying to figure out what to do, where to do it, how to do it, when I should be, choosing this exercise or this exercise, and how many repetitions to do. I mean, there are a lot of questions that I think runners have and a lot of coaches too, have a hard time of figuring out how to make this effective for the endurance athlete, which again, I think it's just different than other people.
Man, I am that typical runner where it's so hard for me to get in the weight room. Like if I had to choose between lifting and running, I'd do it every single time. And even in like college, I would skip out on the lifting.
Yeah.
It's hard for me.
Yeah.
But you're saying if I do it, I'll probably be a stronger and better runner. Less injury.
I think so. You'll get some debate. I think so. If we look in the literature at soft tissue injuries, which is what most runners get, you can decrease your risk of developing those by just doing simple strength training twice a week, 30-40 minutes.
So yeah, tell me a little bit how I could incorporate it. Well, me, but then there's like the athlete.
I guess personal information and act like it's part of the.
This is my world. I love talking about this stuff. You let me know.
For someone who hates lifting, there's me, and then there's like the endurance athlete who's training.
Yeah.
So use me first. Like how could I incorporate it into my training?
Yeah.
So me, I am running probably like 4 to 5 times a week.
Yeah.
I'm not racing, but I do want to improve on running since, I've had a baby.
Yeah.
And I'm trying to get back there. Yeah, go with me.
Yeah, sure. So,
free info, let's go.
If in an ideal situation, runners lift twice a week. Sometimes I'll have runners lift 3 times a week. That's a special circumstance if their schedule can allow it and they want to do it.
Twice a week. So that's like really fast, like
twice a week, 30 minutes.
Twice a week, 30 minutes. Okay.
I don't think you're supposed to lift
even
like that.
20 minutes. But this is a conversation I have with any new client when they come in for an assessment with me, is is about being honest with what your current situation is and what is realistic for you as an individual.
Yeah,
because
I think that's
I have
such a great conversation.
Yeah, I have some people that can lift 3 1-hour sessions during a week, and it's not an issue. They do it for years, and that's awesome because we get to explore a lot of different things. And I have other people that have 3 kids and a job, and it's hard enough to run.
Yeah.
They can give me 10 minutes 3 times a week, and
What's
so
in the grocery sacks.
right, and so we figure out what can we do that's the most effective with that time period.
Realistic.
So it can
individual.
help you as an individual. And this is where, again, I think a lot of runners, stumble, is that they if they do have time for exercises, they don't necessarily focus on things that are going to be helpful long term, and they don't have a progression to what they're doing, just like they need to have a progression in their training plan. If I went and ran the same route every day for the next 5 years, I would get better to an extent, but I would quickly taper off that improvement, and I would be stuck at what I was, what I had made. And if that's what I wanted to do, great. But if I want to get better, I've got to change the stimulus. It's the same thing in lifting, where I will get people that'll come in and they've been doing some exercises that they saw in Runner's World, or maybe they were given by a therapist or a chiropractor, someone when they had an injury. And they think these exercises are holy, and they just have to keep up with these. And it's like, no, you needed to move on from that 2 years ago.
Yeah.
Because the body gets used to what we asked it to do. And so for a lot of people, are you doing a squat? Are you doing a deadlift? Are you carrying something? Are you doing something with your upper body? And that's it. So in the world of strength and conditioning, we classify exercises by you can classify by the muscles that are being used or the movements that are happening. And so Dan John is the person that I learned this from. He's a strength coach, really good strength coach. But it's out there with a lot of different authors where, during every session, we should be doing something where we move from the hips. That's a deadlift or a bridge. We should be doing something where we move from our knees predominantly. That's a squat or a step up or lunges. We should do something where our upper body is pushing something away, something where our upper body is pulling something towards us, and something where we are carrying something. Within those categories, we have a lot of different options. And that can come down to past injury history, what access you have to equipment, and what you like to do. And if we can plug in those things, I can get you through a session in 20 minutes with 3 exercises, and we get you in and out and on your way. And again, it's not to say that that's...
I guess I could do that.
Yeah.
I could do that.
It's not to say that that's the
Get
ideal...
Sammy's truck he likes, and he'll be entertaining.
Yeah.
There you go. It's not to say that that's the most ideal situation for everybody, but the goal is, if you look at 6 months, you train consistently and you lift consistently. And if that means it's 20 minutes twice a week and 5 runs, that's a whole lot better than trying to fit a whole lot in, stressing yourself out, and either then under recovering, not performing on your workouts, or getting an injury because you're trying to do too much. And so with my clients, it's always a continuing conversation where, I have a couple clients that are in med school. They have weeks where they have a lot of tests. We can't lift as heavy that week. That doesn't mean we stop lifting. That means we pick the right options at that time period. And I have a lot of high school kids that come lift with me in the summer where they're not running as much. We can go really heavy, and we can go do pretty challenging stuff. And so it all depends on what your situation is like currently and where you're going towards, and figuring out what's right for you.
What about a more elite athlete who might be training for something or trying to improve?
With Boston coming up.
Yeah.
Yeah, sure. So I look at how we go about exercises like a pyramid. So if we're at the bottom, the base of the pyramid, if we get you doing a really simple programming, do 3 sets of 10 squats, 3 sets of 10 deadlifts, 3 sets of 10 push-ups, and 3 sets of 10 pull-ups. Do that for the next 6 weeks, twice a week. You'll get a lot better. I would say that's the base of the pyramid. So really simple, general strength training. We do that, you're going to get better. At some point, you're going to get used to that stuff. Now we need to go to heavier weights, or we need to go to faster movements. And that we're going to get up higher on the pyramid. And now we need to focus on maybe more aggressive plyometrics. We're going to get up higher on the pyramid. Now we're going to focus on very technical lifts. We're getting up higher on the pyramid. And so the biggest bang for our buck with everybody is low-level stuff like that. And then you just figure out, as your body adapts, how do we make this more? I think for most people, they assume that elites are going to be absolutely perfect with all those things. And there's a lot of people that are really good runners that really struggle with basic lifts, or triathletes too. And so you got to figure out what's the right lever for us to pull on right now when it comes to lifting. And as we get better at stuff, we got to make the things that we're doing more challenging, so our body gets to adapt. So much of what I do is focused on that idea that we need to provide some type of a stimulus to the body so it can adapt. And then it's going to get used to that, and we have to change something.
Again.
Yeah. And so, and that underlies whether we're coming back from an injury, or you're looking at coaching and how we're trying to peak you for a race, or you're looking at lifting. All that stuff works together.
Which I can see like the huge benefit of having someone like you versus, like, I would say, more often than not, I'm doing the same thing, as a runner or over a lot of time, and it's been kind of plateauing.
And it's good to see runners moving away from the fact that they used to think that lifting then made them too heavy or too big to run.
Yeah, and there are certainly a lot of misconceptions about what lifting is going to do for you. And yeah, the idea that you're going to gain a bunch of weight from lifting weights is really, if you're running any amount of volume, is just not true. Your body composition might change, your muscle to fat ratio, or the size of your bones, like those things might change, but you're probably going to see very negligible differences in overall body weight. And if you do gain weight, it's going to be stuff that's going to be helpful towards you. It's not the idea with running is not to make you as light as possible.
Right.
And so it's about, again, putting you on the starting line in the best position to succeed. And so that's one misconception. The other misconception is that if I lift a bunch of weights, I'm going to have magical running form. So again, going back to what I talked about when I used to think that I was just going to fix everybody's problems by having them run the right way. We get that same idea with a lot of the exercises, where if I'm going to do this exercise, I'm going to magically be able to activate a certain muscle or do something differently now when I run because of what I'm doing when I'm lifting. And again, that's just not the case. We don't see that in the literature. The idea is we are trying to make physical changes to the tissues of your body so you can deal with training better. So you magically lifting weights doesn't necessarily make you a better runner, but it's probably going to help you be able to hold a faster pace for a longer period of time, not break down as much as you go into your longer runs, be able to maintain an upright posture and stay relaxed as you're getting tired. So there's a lot of stuff out there that what this is going to do for me, and a lot of stuff that's just not true.
Well, great. Can you share with us a little bit more about, one, your book, and two, your podcast?
Sure. So Chris, myself, and Joel, we wrote a book called Running on Resistance. This came out a few months ago. It's on my website, and it's on Chris's website. And it was us trying to put on paper what we do on a day-to-day basis. It's very hard to write a standard program. So if someone comes in and asks me, what's the best exercise for runners? I would say, I can pick a couple that I think would be good, but it really depends on the person. So what we did was we went through some of those categories that I had already mentioned and say, okay, these are the best bang for our buck exercises. Let's teach runners how to perform them well, how to progress them, and be able to plug that into your training so you can be in a better position to race. Because not everybody has access to trainers or coaches or people that are able to do those things for them. So this was a way for us to say, this is our bread and butter, and to teach clinicians how to progress runners through exercise, which is another thing that I think a lot of people have a hard time with, again, myself included, where we're trying to say, what are the demands of running? How do the exercises and the things we do match those demands? And that's what we try to do with the book, was taking people through a period of time where they're learning how to master these things so running and triathlon goes better for them. And so we have different plans in there for the older runner, a youth runner, the triathlete, about how to incorporate this stuff with access to minimal equipment, a step, some dumbbells, a little bit of resistance band, nothing where you need access to a lot of fancy equipment, and you can get it mostly at the gym. So we put that out a few months ago. And that was a lot of fun to work on. We have been doing a podcast for the last few months as well, where Chris and I talk about all this stuff, where we talk about some of the misconceptions about lifting and how to manage stress fractures, and how to watch someone run and figure out, do we need to change how this person is running, or do we just leave this thing alone? And that's called the Runner Zone podcast. It's on the iTunes store and everywhere else where you can download podcasts. So it's been a fun journey, just kind of delving into all this stuff.
Great.
Cool.
We'll be sure to put that in the show notes.
Yeah, I need to start listening.
Mm-hmm.
Yeah, I do. Well, we love to ask every interviewee how they live out the Phit philosophy themselves. So how do you balance performance, health, intellect, taking time for self? You're busy. You're working. You've got two boys.
You're kind of like us in male form.
You are. You are us in male form.
As best as I can, and definitely not perfectly. So
Can I ask you how old your boys are?
Our oldest is 3. His name's Nash.
Your oldest is 3.
And then our youngest is 7 months. His name is Nolan.
Gosh. Nash and Nolan.
Yeah. How to balance that out. So I am, I used to exercise a whole lot. I would say I was on the side of too much, probably. And now it's just like,
you have all this time. Why not, right?
And so I definitely am not in nearly as good a shape as a runner as I used to be, and I'm okay with that. So some of that's just like understanding where, for me, I am going to get the most out of the time that I do have to exercise and stuff like that. So I like to run. I like to cycle. I like to, mountain biking and lifting weights and all that kind of stuff. But I like to joke that I'm currently tapering for a race that I haven't signed up for yet.
Tapering.
So,
I'm tapering all the time.
Right. So, the goal for me is to exercise 7 days a week. And sometimes that's going for a run for an hour or lifting weights, and sometimes it's going on a walk. So I try to do that. I drink a lot of coffee. That's definitely helpful. I told Becca when we first met that if she ever learns any research about how coffee is bad for you, that I would prefer not to know about that. I think that being active, and I think that that's changed even in the couple years that I've had my business, where you figure out this. I don't think that you can ever have this perfect ideal balance between work and fitness and family and all these other type of things, but you got to pick your priorities. And for me, it's I got to make sure that my business is doing well. But I also know that if I'm super busy and not taking care of myself, everything suffers. And so you have to remember that stuff as best as you can.
Great.
I'm totally going to use that. I've been tapering since my marathon in 2009. That's my last marathon. I've been tapering ever since.
Yeah.
Well, thanks so much for coming on. We'll be sure to put everything on our show notes so they can get a hold of you. And also want to add, you tend to have really great little YouTube. Is it on YouTube? You have videos that show some of the lifts that are
Oh,
nice
sure.
to watch.
Yeah. So Facebook, Instagram, and YouTube, it's all Running Mate KC. I try to, whenever I produce stuff for social media, whether it's writing or videos or any of that stuff, I try to just produce things that hopefully are helpful, whether it's an idea or it's exercises and things like that. So those are all on on all my pages, and there's, I don't know how many videos I have up now, but there's a lot. But yeah, and if there's stuff that people have questions about, they can always shoot me a message or an email or something too.
Great. Or just set up an appointment with you.
Absolutely.
All right. Well, thanks for coming in.
Thanks for having me.
Bye, Queens.
Thank you to our sponsor today, Sentimano Counseling. Sentimano Counseling is the premier perinatal mental health practice in Kansas City, treating mood disorders during pregnancy and postpartum, perinatal loss, infertility, eating, and exercise disorders. Go to sentimano.com for further information about the practice and services. For additional information on today's topic and guests, follow us on Facebook, Twitter, and Instagram at Fit for a Queen. And
Hashtag Fit for a Queen.
Don't forget to rate us on iTunes. We can't wait for you to join us next time on Fit for a Queen.
Bye, Queens.